Hi, our group will be going over disability for Psy670 cultural diversity, and my name is Maci.
My name is Tyler Heiss.
And my name is Ian Perkins.
So I will be introducing our topic today. So the purpose of our presentation is to inform people of what disability is and how it impacts the field of clinical psychology and practices in psychotherapy. To define a disability, according to the American Psychological Association, a disability is a lasting or mental impairment that significantly interferes with an individual's ability to function in one or more central life activities, such as self care, ambulation, communication, social interaction, sexual expression, or employment. And then the prevalence of a disability, according to CDC, 1 in 4 adults have a disability. Age group wise, people 65 years and older are more likely to have a disability, and women have reported are more likely to report having a disability as well. The most reported disability in young adults was a cognitive disability. However, for middle and older adults, the most commonly reported disability was mobility disability. And then living in poverty has a huge impact on the prevalence of disability. For example, people living in poverty reported mobility disability 5 times as common as those living twice the poverty level. Okay, so a little history on our topic. So, past perceptions for people with disabilities, individuals with disabilities were sometimes referred to as idiots. People also believed that the physical issues they were facing were from like divine intervention. So sometimes they would believe that the difficulties they were facing were from evil spirits or supernatural causes. Um, there's also reports of people using individuals as a joke and keeping them around to like poke fun, publicly humiliate them, things of that nature. For practices and institutions, as Christianity spread and the stories of Jesus showing compassion to the sick, the blind, and the lame, more humane practices towards people with disabilities formed. However, this was still a very slow process because later asylums formed for those with disabilities, and they didn't truly understand the cause of the disability or how to even treat it. And so they basically were just hiding them away from society, like taking them off the streets basically to make it look like they were treating them and they were getting better. But once they went to these asylums, they rarely ever left. And then for disability rights, one of the first disability issues assessed by Congress was in 1950 when they created a public assistance program for those disabilities, which involved financial aid from the federal government. And then in 1975, special education was implemented into public schools, which is known as the IDEA Act, which is Individuals with Disabilities Education Act. And then later in 1990, the American Disability Act, also known as ADA, was implemented to protect those with disabilities from discrimination in the maybe the workplace or anywhere else. Um, okay, so some key concepts and terminology we're going to be using in this presentation that I wanted to go over. First and foremost, special education. It's very important for those with a disability. It ensures that people with disabilities have the right to an education. And it also gives them an individualized education plan, also known as an IEP, which sets up a personalized plan for the way that their education will go while they are attending school. And it can make accommodations for them. And then the language that we use when referring to people with disabilities is very crucial in therapy. Like the terms idiots, mental retardation, and other harsh language should never be brought into the session nor outside of it towards a client that is dealing with a disability. So language is very important when referring to individuals with disabilities. Another term we will discuss ableism and discrimination. Ableism is discrimination against a person with disability. So when working with a client who is battling a disability, it's important to create a safe environment for them to discuss the discrimination that they have faced, without them feeling judged or misunderstood, and not to assume not about any biases or assume anything about them. There are also challenges that people with disabilities face on a daily basis, and only they will understand what they are going through. So it's very important for a therapist to acknowledge the struggles of the client and not minimize them in any way. Okay, and then the last term I wanted to talk about is independent living. People with disabilities may want to live independently, and not too long ago, they weren't able to. They were put in these institutions and never were even taught basic life skills to try to let them live on their own or even encouraging them to. So it's important that the therapist gives them the best resources to live independently as possible and help the client come to the safest and healthiest decisions about living independently that will benefit their physical and mental health.
Disability varies in its impact on a person's life. Individuals with a disability face higher unemployment and poverty rates, not only from the potential symptoms of the disabling condition, but also discrimination in the workforce or ableism. Berzerkici and Boehm conducted a study that found that when individuals with disabilities boarded a bus and presented a card that designated them as a person with a disability that allowed them to ride the bus free of charge, they would feel shame, anxiety around social judgment, and feel discouraged from using the bus in the future. Similarly, many job applications will have a question that gives the person a chance to identify if they have a disability, and it's possible that these questions may invoke a similar negative feeling as presented in this study. And what's important to know about mainly the study, is that there were no negative social interactions that the participants experienced while boarding the bus. So what we're seeing here is more of this internalization of negative societal attitudes surrounding disability into a self-stigmatizing behavior that can then limit the person from engaging in employment and finding a job. And this serves as just another challenge that individuals with disabilities face. However, every individual experiences their disability differently, and this is a key point. And these differences arise from what causes the disability, their personal dispositions, negative social interactions and experiences that they've had, along with when the disability began and the influence of their other sociocultural identities. And one of the big differences between types of disability is a visible disability and an invisible disability. A visible disability, you're more likely to have accommodations for them. So, for instance, paralysis of the lower body, there's going to be more accommodations made by other people, and they're generally going to be treated with more compassion compared to an invisible disability like autism or major depressive disorder. Advocacy around disability should primarily focus around fostering resilience for individuals with disability. And resilience is really the ability for a person to navigate resources to help improve their quality of life and give them protections from discrimination. And one major act that did that is the ADA Act of 1990 and the ADA Amendments Act of 2008. And what this did is set aside a bunch of medical conditions and made individuals that had them protected under the law from discrimination in the workforce and the public sphere and from private businesses that operate in the public sphere, like hotels. And disability advocacy, so as either a therapist or a doctor who often give out medical diagnoses that are a disabling medical condition, they can work to inform clients of their rights under the ADA, help guide them to employment agencies that work specifically with individuals with disabilities. And then they can also help them with paperwork for acquiring disability insurance, whether that's Social Security disability insurance, a private disability insurance, etc. And in the future, we mainly want advocacy to focus on maintaining and strengthening ADA-related regulations and then decreasing negative public stigma around disability.
Now, having discussed everything that we have so far, we're going to start looking at some applications of disability for clinical psychology mostly. So, to start, practitioners should provide accessible care, as Ian has spoke on. Practitioners should learn about disabled populations through higher education programs such as medical and graduate schools. However, not only should clinicians be educated on disabled populations, they should also be given training and practice with disabled populations if it's possible to do so. Because in doing so, practitioners can build practical competencies and understandings of these populations and the unique challenges they face. Moving on to clinical psychology, practitioners should always strive to reduce the stigma around disability. One way that they can do this is to increase the recognition of all disabled populations, not simply the ones that are easy to see. But not only increasing awareness, practitioners should also empower clients with disabilities. In empowering a client with disabilities, a practitioner may connect disabled clients with resources for support and connection, which all ties into clinical training and research. Practitioners should be educated on and provided with disability-specific training so they can better help these populations. But moreover, psychological practitioners in the research field specifically can continue conducting disability-affirming research to improve and modify current models of treatment so that therapists and counselors alike can provide best practice care for these clients. Now we're going to conclude and wrap everything up. So even though there has been a lot of progress for individuals with disabilities, much more still needs to be done. As Maci helped us to see, disabilities have been common throughout history, and they are still common today. But it's only been relatively recently in our history that we have begun to give them the attention and care they deserve, instead of hiding them away in institutions or otherwise. An individual rarely faces the effects of disability in their life in one context or area. Oftentimes, disability permeates throughout an individual's life and affects many or even all aspects of it. This impact becomes even more noticeable for individuals with multiple disabilities, wherein this effect may compound. This gives rise to a call for action. As we've hinted at in this presentation, working with populations who experience the effects of disability may require practitioners to advocate for their clients. This advocacy could include empowering them within sessions, sure, but it can just as easily extend outside of the session when clinicians provide resources for the client, such as food, housing, employment, and or recreation opportunities to help the client meet all of their needs, not just their psychological ones. Unfortunately, given the nature of this presentation, we cannot answer any questions directly here. However, we encourage you to continue searching for answers with the same openness, honesty, and curiosity that these populations deserve. On behalf of our team, thank you for your time and attention listening to our presentation. Here we have our references for the video. Slide 1 and slide 2. Thank you again.